Good evening, and welcome to the 16th Annual Houston Methodist Hospital Resident and Fellow Graduation. I'm Dr. Laura Colton, and I have the privilege of serving as designated institutional official for the Houston Methodist-sponsored residency and fellowship programs. Although this evening's event remains virtual, I hope everyone shares my optimism that there is a light at the end of the tunnel. You all have worked incredibly hard to achieve your training requirements and have accomplished this in the midst of a pandemic and despite the immense challenges of COVID. Tonight, we ask you to please take a moment and reflect on your accomplishments. We are honored to share this momentous occasion and want to give proper recognition to your achievements and successes. And although we had hoped to be back in Crane Garden this evening, we will still celebrate the 45 training programs and 116 graduating residents and fellows, along with their families, friends, and our Houston Methodist faculty and staff. We hope that you will enjoy this evening's program and will share it with those who have been by your side along the way. Thank you all for your flexibility and understanding. I'd like to take a moment to acknowledge those who have helped support our residents and fellows throughout their journey. Dedicated program directors and coordinators, expert teaching faculty, interdisciplinary colleagues in nursing, pharmacy, and therapy that work closely with residents, supportive hospital administration and leadership, and the GME office staff who tirelessly champion the needs of our residents and advocate on behalf of their programs. It is truly an honor to witness such perseverance and determination. We know that you will flourish in the years to come and hopefully enjoy much success in your personal and professional lives. In a few moments, you will hear from our President and CEO, Dr. Mark Boom, and Executive Vice President and Chief Innovation Officer, Dr. Roberta Schwartz. Both will extend their congratulations and encouragement as you embrace on your new professional responsibilities while skillfully navigating the ever-changing world of medicine. I also have the distinct honor to introduce our keynote speaker for the evening's event, Dr. Rex Marco. Dr. Marco graduated from UCLA Medical School and completed his orthopedic residency at UC Davis. He continued on to Memorial Sloan Kettering Cancer Center for his musculoskeletal oncology fellowship before heading to Rush Presbyterian St. Luke's Medical Center for his spine surgery fellowship. Dr. Marco has served as Chief of Reconstructive Spine Surgery and Musculoskeletal Oncology, Vice Chairman of the Department of Orthopedic Surgery, and Program Director of the Spine Surgery Fellowship until his accident in 2019. Throughout his prolific career, he has published dozens of peer-reviewed journal articles, written 20 book chapters, given over 200 presentations and lectures, and mentored countless young physicians. Currently, he is the Chief Medical Ambassador for the Reeve Research Collaborations at the Christopher and Dana Reeve Foundation and is Emeritus Staff in the Department of Orthopedics and Sports Medicine. Dr. Marco is also a certified mindfulness meditation teacher, and his words have reached countless audiences, including his podcast entitled, When Life Takes Your Breath Away, and as the invited speaker at our house staff-sponsored George Floyd Candlelight Vigil last June. Tonight, he will share his incredible story of how his life changed in an instant and his courageous journey of recovery, resiliency, and his resolve to increase awareness of spinal cord injury. But first, it is my pleasure to introduce Senior Staff Chaplain Hillary Challa from the Department of Spiritual Care and Values Integration at Houston Methodist. She will begin our ceremony with the invocation and will be immediately followed by Drs. Boom and Schwartz.
Hello. Thank you so much for joining all of us for this wonderful graduation. We are so proud and honored to have you be part of us, and I'm honored as the Physician Organization Chaplain, Hillary Challa, to be offering your invocation. I'm Greek Orthodox and will be praying in that tradition. Let us pray to the Lord. Lord, have mercy. O Heavenly King, Comforter, you are the Spirit of truth. You, Lord, are present in all places, and you fill all things. You are the treasury of blessings, and you, Lord, are the giver of life. Come and dwell in us, cleanse us, and heal our souls. Dear God, we pray for you to please guide, guard, protect. Grant your Holy Spirit of strength, comfort, peace, and knowledge to the mind, body, heart, and soul of all of our graduates. We thank you, Lord, for every rich blessing that you have given us. We thank you that you have blessed each of them with the awesome ministry of providing health care to others. We pray, Lord, that you continue to fill each person up with your Holy Spirit, enlightening their minds and their hearts and guiding their hands as they endeavor to heal your children who come to them seeking your healing from their hands. We pray, Lord, if there's anything that would prevent them from offering good medicine, that you remove it far away from them. We pray, Lord, that you grant each of them and each of their loved ones holy guardian angels to be by their sides every day of their lives, sheltering and protecting them and their medicine. Through Jesus Christ, our living, resurrected King and Lord. Amen.
Good evening. I'm Mark Boom, the President and Chief Executive Officer of Houston Methodist.
I'm Roberta Schwartz, the Executive Vice President and Chief Innovation Officer at Houston Methodist Hospital.
And it's our pleasure to welcome you to the 2021 Resident and Fellow graduation, actually our 16th of such graduations, and unfortunately the second that we're having to do virtually, but I sure hope the last ever that we have to do virtually. We're so delighted to be here with you today and to celebrate your wonderful accomplishments. We are proud of everything that you have done. You're a very unique class of individuals. A few of you who came here for 1 year, came here during a pandemic and are going to leave during a pandemic. But for most of you, you didn't know quite what you were signing up for when you came here. And I will tell you, what our organization has accomplished and what each of you has accomplished is nothing short of phenomenal. We are so proud of you. And I know Roberta has many stories at the front lines of seeing the contributions our residents and fellows made. Roberta, why don't you share some of those with us?
Yeah, it was really incredible to actually watch each and every one of you take on not only the COVID populations, but even the surges in population that we've had after COVID as we deal with the impacts. You never hesitated when you went into a room. You never hesitated to take on a job that you may not have been prepared for, and you embraced every one of the challenges that we put before you. I can't say enough thank yous on behalf of the patients and the walls of gratitude that there are for everything that you did this year and all of the years that you've been with us, but especially in this time of COVID.
I often say it is a tremendous privilege to be a physician. It's a calling to be a physician. It's a calling to be a nurse. It's a calling to be an individual who chooses to work in healthcare. And never more than this year have each of you answered that calling and played a really special role in helping society. I think what we've seen this year is what a special leadership position it is to be a physician. Physicians are looked to as sources of truth. Physicians are looked to as sources of inspiration. And throughout a difficult pandemic that has obviously been incredibly trying directly with the suffering and the death that has occurred, but also incredibly trying societally as we've argued and bickered and dealt with much dissension throughout our society, physicians have been that calm, middle of the road, just the facts, and we will focus on the right things to do. And each of you have done that. And so I hope that as you think about that special role you have in society, that you take the lessons you've learned. Some of you are graduating and will be finishing and going into practice, private practice or employed someplace all around the country, locally. Some of you are moving on to your next residency or your next fellowship and will have a few more years before you move out into the world. But all of you will serve as leaders in your community, and that is just such a special privilege. And I hope you take those learnings that you have gotten through Houston Methodist and the time you are here and apply them in your life and apply them as leaders in the community. Roberta, our eye care values have shined during this time, and I think that's one of those lessons I hope each of us take from the time that we have at Houston Methodist.
I think the most amazing part that I hope you take with you is this foundation in the eye care values. And I know that you have each imprinted upon us and demonstrated to us just how both important those are to you, but also how important those are going to be in the world and the life and what you're going to take with you. I think it was amazing to me to watch how residents and fellows fought to be a part of everything that we were doing. And it was incredible to watch how the nurses and all of the staff turned to you. I have to say, I watched them as they looked at you. Were you going to get vaccinated? Were you going to walk in the room? What were you going to do? And how were you going to treat people? And the maturity that you demonstrated in this time was absolutely incredible. But it's because of that foundation. You came to us because of those values. You flourished through those values, and you take those values with you. And I hope that is something you will always remember.
You know, this year I've talked about the sacred and that sacred and was caring for patients with COVID and caring for patients who did not have COVID but needed other things medically, and taking care of each other as an institution. And I hope that word sacred resonates with each of you. I hope that as you think through your profound responsibility as a physician going forward, that you always reflect upon the privilege it is to practice medicine, and that you love practicing medicine. Keep to the joy of medicine, find fulfillment, recognize what a treat it is, what a joy it is, what a privilege it is to be led into people's lives at some of their most vulnerable times. Replenish yourself, take care of yourself, have a wonderful, wonderful life with your family, and stick with these lessons that you've learned from Houston Methodist, these values, and I think they will lead you on a road of prosperity. Please don't forget about us, please. Many of you will work here, do further fellowships here. Many of you will come back and visit. We are so glad that you chose Houston Methodist for your training, are so thankful that you did so, and we wish you many blessings in the future. God bless.
Thank you, Dr. Boone and Dr. Schwartz. My name is Rex Marco, and I'm the Chief Medical Ambassador for the Christopher and Dana Reeve Foundation. And I'm truly grateful and honored to have this opportunity to address you as you move forward on your journey to becoming an attending. I clearly remember when I was graduating from my residency program and my fellowship programs, and it was such an exciting and new time for me. I really felt like it was such a great accomplishment, and I was ready to move forward. What I'd like to leave you with in this address is 10 things that I wish I had listened to or had known when I graduated from my residency and fellowship. One thing that I did listen to was my financial advisor or insurance agent. I'm not sure which one he was, but at that time, I was given the opportunity to listen to options for disability insurance and life insurance. And I didn't take the opportunity to buy life insurance at that time because I wasn't ready. But after my fellowship, I did take the opportunity to buy life insurance and think about the options for term or whole life. And I'm really grateful that I did take that time and opportunity to purchase life insurance at that time. I actually had the means to get both policies, and if you have that option, it's probably something that would help you. The other thing that was presented to me was disability insurance, and buying insurance was clearly the last thing that was on my mind, because I wanted to start living life, get a car and a house, and do things that I didn't have the opportunity to do when I was working so hard in medical school and residency. But purchasing disability insurance was clearly one of the best things that I did, and you'll learn a little bit more about that later on in this talk. One thing to consider is things like occupation-specific disability insurance and cost of living adjustment disability insurance. Those two things are really important, as it does change options. If you ever do become disabled, it does change your options for you if you have to use it. The next thing that I would like to leave you with was something that was recommended to me, was reading The Millionaire Next Door. And reading that book was really a great experience for me. One thing that it talked about was doing your best to live in a middle-class neighborhood, because most of the millionaires in America actually live in a middle-class neighborhood below their means. Their expenses are less than their income. They invest in long-term investments. They own the house for over 20 years. They don't get money from their parents, and they are able to save enough money to live at their current level for 10 years. And most of you are going to have that ability moving forward. My debt level was the equivalent of $150,000, and my salary was at about the level of an average family practitioner. And if I had listened to the advice for The Millionaire Next Door, I think I would have a lot more freedom and a lot more options. And sometimes it's difficult because our partner may not have the same desires. But that brings me to the next thing that I would wish I had heard, and that's number 3, which is do your best to have one house, one car, and one partner your whole life. If you had told me that when I graduated, I would have thought you're crazy. Looking back, I wish I could have had one house and one car and one partner my whole life. Right now, I've had 5 houses, 6 cars, and now I'm divorced. Life changes a lot. If you focus on your relationship with your partner, you will have much more freedom, especially financial freedom. And if you really want to have financial freedom, work on that partnership and think about not striving for a bigger house or a nicer car. And that's another thing that the principles of The Millionaire Next Door teach you. And that brings me to when I came to Methodist. I was at what I thought was a high in my life and my career. I had a nice house, I had a nice car, I got a promotion to vice chairman of the Department of Orthopedic Surgery, and life was great. So I thought. In that moment, I got a phone call from a police officer in New York. And he said that my son had just been involved in a near fatal accident, and thankfully he survived that accident. But it was an extremely difficult time in my life. And I realized that my relationship with him and my other kids and my wife were really not where I thought they were. And eventually I went through a very difficult divorce and tried to find some peace and calm around the difficulties that I was going through. And one thing I did was I took a course in mindfulness. It was a mindfulness-based stress reduction introductory course. And in that course, I got introduced to this app that was called Stop, Breathe, and Think. And this is the fourth thing I wish I knew, was I wish I knew that I could stop, breathe, and think. And this simple app, which was designed for adolescents and people like me with some ADD, self-diagnosed ADD, to stop, breathe, and think. And what that app did was it taught me to check in mentally and physically and emotionally. And it taught me to stop and breathe and think. And then it would give me something to listen to. And listening to this guided meditation would help me relax and feel calm and peace in this very difficult time in my life. And at the same time, I worked a 40 Days to Personal Revolution program where I also started doing yoga, which is moving mindfulness. And the combination of mindfulness meditation with moving mindfulness really helped give me more peace and serenity. And what I didn't know, however, is that I wasn't in touch with my emotions at all. I had very little emotional intelligence. And I learned that when I was in a counseling session with my one son, and he was telling me that he missed his dad, and he started crying. But I didn't believe him because we had gone through a period of time when he was lying a lot. And the counselor asked me to stay after the session and talk to me about her concern that she thought I had PTSD around the thought of losing another child, and that I needed to believe my son. A couple months later, I was at another counseling session with my other son, and I thought with my mindfulness and meditation and yoga that I was doing great, and I had peace and serenity. But after that weekend with my son, the counselor wrote, "I'm concerned that you'll never experience the fullness of an emotional life." and that I think you would benefit from your own personal counseling. And that combination of those two counselors telling me that I couldn't experience or wasn't experiencing the fullness of an emotional life, and that I may have PTSD regarding the possibility of losing another son, led me to take this course called Awakening the Fearless Heart. And this is the fourth thing that I wish I knew, is that I needed to learn about emotional intelligence, and I needed to learn to feel my feelings. And when I took this course, I realized that it's okay to have fear. I didn't know that it was okay to have fear. I didn't know that I actually had fear. When I would scrub into a case, I would feel excitement. When I went to or got to very difficult, life-threatening portions of the operation, I felt excitement. What I didn't realize was that this excitement was fear-based excitement. And I was really more anxious and afraid, or fear, which some people say stands for a false event appearing real, which spells fear. And a false event appearing real is more properly defined as anxiety, because it wasn't a life or limb-threatening problem for me, but I was worried that something may happen. But to me, I felt that was excitement. I didn't realize before this course that it was truly fear and anxiety. And through that fear and anxiety, I had stress and a rush of adrenaline. But that rush of adrenaline and stress and fear led me to harm other people in the room. And I would lash out and speak sternly and have a more harmful tone to my voice and to my surroundings, rather than sit with my fear and know that it's okay to be afraid and have future fear, and relax and wait for that fear or anxiety to diminish. And through that course, I understood that I had anxiety and fear before going into every case. And so what I started to do is, at the scrub sink, I would close my eyes, as I'll invite you to do now, or have a slightly downward gaze. And I would take a deep breath, and I would smell. And I would exhale, and I would taste, and I would inhale, and I would listen, and I would exhale, and I would feel, and I would inhale and see. And if I still felt anxiety or fear, I would repeat the process until my hands were clean and I was ready to go into the operating room. And then what I also learned was that if I had fear or anxiety in the middle of a case, I could reign in that moment. And reign stands for recognize that I have fear. Allow that fear to occur and investigate where in my body that fear is occurring or where I feel that. And what I've learned recently is to lie in that reign when I get to the I. When I'm investigating, I can lie in there. And lie stands for look deeply, investigate where I feel that anxiety or emotion, and then embrace myself in that moment, either by touching my heart or hugging myself, or imagine that I'm embracing myself in that moment. And in that way, I can get to N, which is nurture myself. And I remember one time when I was dissecting a scarred-in tumor from the inferior vena cava, and I could feel that anxiety building up. And in that moment, I recognized that I had fear, and it knew it was okay. And I allowed that fear to be. And I investigated where in my body I could feel that anxiety. And I waited until the anxiety went down. And I had to repeat the process at least 5 times before my heart rate went down and I could move forward and dissect the scar off the inferior vena cava. And the other thing that I learned about emotional intelligence was from Yoda. And Yoda taught me that fear is the path to the dark side. Fear leads to anger. Anger leads to hate. And hate leads to pain and suffering. And if I can not acknowledge my fear before it gets to anger, or acknowledge my anger and realize that it's probably fear-based, then there's a lot less chance that I'll lash out towards myself or other people and cause pain and suffering. The 5th thing that I wish I had known when I was graduating from my residency program and fellowship was the trauma stewardship. And this is a book that I read many years after graduation. And it's about how to care for yourself when you're caring for other people. And what I learned is that through our training as healthcare providers, we undergo a lot of trauma. We see a lot of trauma. We see people suffering. And through that, we ourselves sustain a lot of trauma. And nobody taught me, and maybe not you, how to do self-care, how to manage your stress, how to work through this trauma. And this book gives you a lot of tools to think about incorporating to help you manage your stress, work through this trauma, avoid burnout, and achieve resilience. And some of those techniques and tools that she talks about are mindfulness, moving mindfulness, and activities like that. And a lot of people talk about trainees and doctors experiencing burnout, which is emotional exhaustion, depersonalization, and feeling less than. And so many of us are at risk for burnout from our training and from our work, taking care of our families. And there are studies that show that up to 50% or more residents and trainees experience burnout. And so acknowledging and recognizing that you are at risk for burnout is one of the most important things to understand. And using some of these tools to avoid burnout are really important. Achieving resilience, with resilience defined as the ability to experience difficult situations and come out stronger. And what I learned about resilience is that believing in a caring higher power correlates with increased resilience. And people that have an active spiritual life are happier and healthier and more stress resilient. And for me, believing or learning to believe in a caring higher power has helped me with my resilience. The seventh thing that I would like to leave you with is to be present. For most of my career and family life, and with my kids and with my patients, I was not present. And one thing that has helped me to be present is to listen, to understand, not to be understood. And I'll repeat that again. I learned to listen to understand, not to be understood. Number 8 comes from the book called The 4 Agreements. And in that book, the 4 Agreements, I learned to remember those 4 agreements with this mnemonic: don't spaz, do your best. And spaz stands for the S's: use impeccable words without sarcasm. So don't spaz. The S's: use impeccable words without sarcasm. The P is don't take things personal. And the AZZ helps me remember to not make assumptions. So use impeccable words without sarcasm. Don't take things personal. Don't make assumptions. And do your best. The 9th thing I'll leave you with is something that I learned after my accident. And some of you may know this, and some of you may not. But I was riding in the park on my bike, when I made a left turn instead of a right turn, and my tire got stuck, and I flew over my handlebars, and I heard a crack. I wasn't sure if that crack was my helmet or my neck. And in that moment, I knew that it could be my neck. And when my friend came by and was touching my feet and my hands, and I couldn't feel him, and I asked him if I was moving my arms or my legs, and he told me that I wasn't, even though I was trying, I knew that I had broken my neck and that I was a quadriplegic. And because I couldn't feel or move, I knew that there was less than 5% chance that I would ever walk again, or hold my unborn child, or operate, or coach baseball like I did my other sons. And the work that I had done before that, learning to breathe and asking for serenity to accept the things that I cannot change. I knew that I could not change. That turn, I couldn't get it back. And I knew that I would be okay. I knew that I had a caring higher power that would guide me through the difficulties that I might experience. I also knew that I needed to be present in this moment and not worry about the future or think too much about the past. And the ninth thing that I'll leave you with that I learned after this accident is nothing is perfect, nothing is permanent, including life, youth, and health, and nothing is personal. Nothing is perfect, permanent, or personal. And this is a quote from Ruth King's book called Mindfulness of Race. And this simple statement has helped me a lot. And the last thing that I would like to leave you with is something that I learned being a patient, recovering from my quadriplegia. And that is, when things are difficult, as we're taking care of patients, think about pressing the escape key. And the escape key has the letters ESC. And for me, those letters represent empathy, sympathy, and compassion. And these are things that I thought I had, or I learned that I shouldn't have. And now I know that it's important for me as a physician to have these things. I did learn that it's important for me to empathize and do my best to put myself in my patient's position. But what I didn't learn is that it's also important for me not to take on their emotions of fear or anger or stress. And it's okay for me to let them have fear and anger or sadness, and I don't need to fix that. I can do my best to put myself in their position and empathize with them. And what I also learned is that there's no way for me to empathize with them if I've never had that condition, because I really didn't know how to empathize with the nearly 100 patients that I took care of with paralysis. And now I can, moving forward, looking at your patients and taking care of them. Do your best to empathize with them without taking on their emotions and owning your own emotions. Regarding sympathy, I learned that I shouldn't have sympathy. But now I know that it's okay to have sympathy for someone, and know that I can say, I'm sorry that you're experiencing this, and have sympathy for them. And lastly, compassion, which to me means truly desiring that nobody suffers. And thankfully, you trained at an institution where this is in our eye care values, and learning and maintaining compassion for your patients, yourself, your family members, your kids, and everyone around you is important. And as you embark on your journey to becoming an attending, I truly want to express my gratitude for your service to our patients and their families in our institution. And I want to honor you and your practice of being a doctor and a parent and a partner, and leave you with my love for you moving forward. Thank you very much.
Good evening, and allow me to also congratulate each of you on the completion of your respective programs. My name is Trevor Burt, and I have the privilege to serve as the Vice President of Education in the Houston Methodist Academic Institute. It's always an honor to stand before the graduates to recognize the outstanding and exemplary faculty from your programs, as well as the residents and staff recognized for their contributions to medical education and our community. This year, I have the esteemed privilege to announce the recipients of the annual Faculty Teaching Awards, the Gordon Awards for Leadership and Professionalism, the Outstanding Residents as nominated by the Texas A&M Houston Campus Medical Students, and the Dr. Wadi Suki Outstanding Community Scholar Award. The annual Teaching Faculty Awards, presented by Graduate Medical Education, provides an opportunity for us to recognize those who put great effort and intention into making your training experience exceptional. While this year is undoubtedly different, it should not take away from the recognition that each deserves. Each resident and fellow was given the opportunity on the GME administered annual survey to nominate one or more faculty teachers and to comment on their abilities and commitment to teaching. On behalf of GME and the Houston Methodist House Staff Council leadership, it's now my privilege to recognize the recipients of the 2020-2021 Faculty Teaching Awards. The first faculty awards being presented are to physician educators who have demonstrated outstanding service and commitment to teaching residents and fellows. Each will receive a certificate and an Apple lapel pin. The recipients are Dr. Kelly Gabler, Family Medicine, Dr. Isaac Goldberg, Family Medicine, Dr. Marcia Holloman, Family Medicine, Dr. Polly Niravath, Hematology and Medical Oncology, Dr. Ijaz Janjua, Internal Medicine, Dr. Ruby Shah, Internal Medicine, Dr. Joshua Woody, Orthopedic Surgery, Dr. Pierre Chevray, Plastic Surgery, Dr. Tu Din, Plastic Surgery, Dr. Warren Ellsworth, Plastic Surgery, Dr. Jeffrey Friedman, Plastic Surgery, Dr. Stephen Fung, Diagnostic Radiology, Dr. John Labus, Diagnostic Radiology, Dr. Roberto Ayala, Surgical Pathology, and Dr. Rebecca York, Surgical Pathology. The second group of teaching awards is being given to physician educators who were recognized for exemplary service and commitment to teaching residents and fellows. Each will receive a certificate, an Apple lapel pin, and an etched marble apple. The recipients are Dr. Mark Hobeka, Abdominal Multi-Organ Transplant, Dr. Terry Clyburn, Adult Reconstructive Surgery, Dr. Arvind Bimaraj, Advanced Heart Failure, Dr. Neil Kleiman, Advanced Interventional Cardiology, Dr. Jay Rowe, Anatomic and Clinical Pathology, Dr. Joseph Mazdu, Behavioral Neurology, Dr. Ekene Okoye, Breast Gynecologic Oncology, Dr. Muaz Al-Mala, Cardiovascular Disease, Dr. Mohammed Chamsi Pasha, Cardiovascular Disease, Dr. Miguel Valderabano, Clinical Cardiac Electrophysiology, Dr. Paul Sherman, Clinical Cardiac Electrophysiology, Dr. Scott Wesley Long, Clinical Informatics, Dr. Blythe Gorman, Cytopathology and Surgical Pathology, Dr. Abhishek Kansara, Endocrinology, Dr. Jarara Shakil, Endocrinology, Diabetes, Dr. Trisha Cub, Endocrinology, Dr. Scott Rand, Family Medicine, Sports Medicine, Dr. Michael Pirix, Female Pelvic Medicine and Reconstructive Surgery, Dr. Ricardo Gonzalez, Urology and Female Pelvic Medicine and Reconstructive Surgery, Dr. Eamon Quigley, Gastroenterology, Dr. Rodolfo Oviedo, General Surgery, Dr. Sai Pengali, Hematology and Medical Oncology, Dr. Arthur Ziske, Hematopathology, Dr. Megan Ketchum, Hematopathology, Dr. Alpesh Shah, Interventional Cardiology, Dr. Devin Olek, Medical Physics, Dr. Leonard Goldberg, Micrographic Surgery, Dr. Jessica Thomas, Molecular Genetic Pathology, Dr. George Nasser, Nephrology, Dr. Hassan Ibrahim, Nephrology, Dr. Horacio Adrigay, Nephrology, Dr. Tanu Garj, Neuroimaging, Dr. Paul Holman, Neurological Surgery, Dr. Erica Green, Neurology, Dr. Andrew Lee, Neuro-Ophthalmology, Dr. Suzanne Powell, Neuropathology, Dr. Christopher Hobday, Obstetrics and Gynecology, Dr. Preeti Shackle, Obstetrics and Gynecology, Dr. David Lentner, Orthopedic Surgery, Sports Medicine, Dr. Patrick McCulloch, Orthopedic Surgery, Sports Medicine, Dr. Sherry Lieberman, Orthopedic Surgery and Orthopedic Surgery, Sports Medicine, Dr. Mukhtar Al-Sadi, Pulmonary Disease and Critical Care Medicine, Dr. Matt Koshnevis, Pulmonary Disease and Critical Care Medicine, Dr. Parachi Dubey, Radiology Diagnostic, Dr. Megan Ketchum, Selective Pathology, Dr. Luan Trong, Selective Pathology, Dr. Mary Schwartz, Surgical Pathology, Dr. Rex Marco, Spine Surgery, Dr. Constance Mobley, Surgical Critical Care, Dr. Rose Kavari, Urology, Dr. Rajan Gadia, Vascular Neurology, and Dr. Eric Peden, Vascular Surgery Integrated. Congratulations to each of you, and thank you for your ongoing commitment to creating an outstanding learning environment for our trainees. In 2017, the Houston Methodist GME Committee awarded the inaugural Sherilyn A. Gordon Memorial Award for Distinguished Leadership and Professionalism in Medical Education. The intent of this annual award is to be a perpetual reminder of Dr. Gordon's leadership to those who had the privilege of knowing her, working alongside her, learning from her, or having been cared for by her. Annually awarded, we recognize an outstanding Houston Methodist resident or fellow, a program director or faculty member, and a residency program coordinator who consistently demonstrate commitment to medical education, research, mentorship, and professionalism. All traits embodied by Dr. Gordon through her devotion to medical education at Houston Methodist. Each recipient of the Gordon Award will receive a commemorative plaque, their name listed on the perpetual plaque that remains in the GME office, as well as support to attend a leadership or professional meeting advancing their career as Dr. Gordon would have encouraged. It is now my honor to present the 5th annual Sherilyn A. Gordon Memorial Award for Distinguished Leadership and Professionalism in Medical Education to resident Dr. Sarah Hoops, PGY4 Obstetrics and Gynecology resident, Program Coordinator, Ms. Brooke Moore, Manager of Education Programs for the Department of Cardiology, and Program Director or Faculty, Dr. Parachi Dubey, Diagnostic Radiology. Congratulations and thank you for your commitment to leadership and professionalism in medical education. I know that Dr. Gordon would have been so proud to work alongside these phenomenal women leaders in graduate medical education. Each year, the Texas A&M Houston campus medical students recognize outstanding residents who were instrumental in providing exceptional teaching, support, and encouragement. This year, the residents recognized by the graduating class of 2021 are Dr. David Detz, General Surgery Clerkship, Dr. Sarah Hoops, Obstetrics and Gynecology, PGY4 Clerkship, Dr. Akhilesh Padye, Internal Medicine Clerkship, and Dr. Barrett Riddle, PGY3 in the Radiology Clerkship. Thank you all for your support of the next generation of physicians on the Houston campus. Finally, due to the generosity of a grateful patient's family, in 2019, Houston Methodist began awarding the Dr. Wadi Suki Outstanding Community Scholar Award. This award recognizes residents or fellows who care for those in our community through the Community Scholars Program. This year, we are delighted to recognize PGY5 Nephrology graduate Dr. Subi Altaki. Thank you for exhibiting a passion for providing compassionate care, specialty care to the underserved in our community. It is now my pleasure to introduce Mr. David Kuznarek, Director of GME, who will announce the trainees completing their programs this evening.
Good evening. My name is David Kuznarek, and I'm the Director of Graduate Medical Education at Houston Methodist. I have the distinct honor of announcing the names of our graduating residents and fellows. I will announce the name of the program, followed by the program director's name, and then the name of each graduate. Adult Reconstructive Orthopedic Surgery, Program Director, Dr. Stephen Encavo. Graduate, Dr. Manuel Rodriguez Perez. Advanced Clinical Cardiac Electrophysiology, Program Director, Dr. Miguel Valderrabano. Graduate, Dr. Addie Lador. Advanced Heart Failure and Transplant Cardiology, Program Director, Dr. Barry Trachtenberg. Graduates, Dr. Miguel Castro. Dr. Anusha Sankara. Dr. Pakpum Tantrari. Advanced Interventional Cardiology, Structural Intervention, Program Director, Dr. Neil Kleiman. Graduates, Dr. Tanush Gupta. Anatomic and Clinical Pathology, Suzanne Powell, Program Director. Graduates, Dr. Ahmad Shahabuddin, Dr. Tiffany Shu. Behavioral Neurology and Neuropsychiatry, Program Director, Dr. Joseph Mazdu. Graduates, Dr. Christine Rizik. Breast Gynecologic Pathology, Program Director, Dr. Michael Devers. Graduates, Dr. Michelle Lynn. Cardiovascular Disease, Program Director, Dr. Stephen Little. Graduates, Dr. Brian Sai, Dr. Hassan Rahman, Dr. Peter Rothstein, Dr. Ben Long Isaac T, Dr. Akanksha Thakar. Cardiovascular Imaging, Program Director, Dr. Dipan Shah, Dr. Talal Al-Nabelsi, Dr. George Debu, Dr. Keenan El-Talawi, Dr. Fawzi Amir, Dr. Allison Spangler. Clinical Cardiac Electrophysiology, Program Director, Dr. Miguel Valderrabano. Graduates, Dr. Akanibo Dewaraboko. Cytopathology, Program Director, Dr. Michael Thrall. Graduates, Dr. Shirag Gangahar, Dr. Kent Swimley. Endocrinology, Program Director, Dr. Leila Tabatabai. Graduates, Dr. Jessica Lucier, Dr. Anjani Pandya, Dr. Ivan Serrano Santiago. Family Medicine, Program Director, Dr. Kelly Gabler. Graduates, Dr. Stephen Doucette, Dr. Marin Huck, Dr. Motaz Ibrahim, Dr. Christian Kadiri, Dr. Yandro Liao, Dr. Roberto Medina, Dr. Nicole Thomas, Dr. Nicole Thurmond. Family Medicine, Sports Medicine, Program Director, Dr. Scott Rand. Graduates, Dr. Chuck Wameka Nabwefe, Dr. Maifuang Fan. Female Pelvic Medicine and Reproductive Surgery, Program Director, Dr. Danielle Antosh. Graduates, Dr. Danny Munir. Gastroenterology, Program Director, Dr. Bincy Abraham. Graduates, Dr. Muhammad Ahmad, Dr. Asim Mushtaq. General Surgery, Program Director, Dr. Sylvia Martinez. Graduates, Dr. Man Ali, Dr. Chen Chen, Dr. Aaron Chen, Dr. Kofi Quay, Dr. Fernando Ramirez Daval, Dr. Bassem Solomon. Genitourinary Medical Kidney Pathology, Program Director, Dr. Stephen Shen, Dr. Harmanjit Singh. Hematologic Pathology, Program Director, Dr. April Uten. Graduates, Dr. Jessica Tomsula. Hematology and Medical Oncology, Program Director, Dr. June Zhang. Graduates, Dr. Cesar Gentil Sanchez, Dr. Ashcott Puri. Hematopathology, Program Director, Dr. April Uten. Graduates, Dr. Fadi Alakil, Dr. Jacob Armstrong. Internal Medicine, Program Director, Dr. Melina Awar, Dr. Shadi Abu Ghazala, Dr. Jocelyn Anthony, Dr. Bush Benjamin, Dr. Kimberly Boyd, Dr. Miguel Chavez Cavazos, Dr. Diana Chen, Dr. Lindsay Ewers, Dr. Priyanka Gajula, Dr. Muhammad Khan, Dr. Harika Mehdi, Dr. Celia Pena Heredia, Dr. Humara Sarfraz, Dr. Rahul Singh, Dr. Weining Sun, Dr. Samriti Sayal, Dr. Matthew Taitano, Dr. Wanchen Wang. Interventional Cardiology, Program Director, Dr. Neil Kleiman. Graduates, Dr. Tomoya Hinohara, Dr. Mikhail Narezkin. Medical Physics, Program Director, Dr. Ramiro Pino. Graduates, Dr. Andrew Belicio. Micrographic Surgery and Dermatologic Oncology, Program Director, Dr. Leonard Goldberg. Karash Burokim, Isidore Tarantino. Molecular Genetic Pathology, Program Director, Dr. Jessica Thomas. Graduates, Dr. Debbie Wally. Nephrology, Program Director, Dr. Horacio Adlergay. Graduates, Dr. Subi Altaki, Dr. Anish Bhakta. Neuroimaging, Program Director, Dr. Mohammed Nakawa. Graduates, Dr. Tamea Horix. Neurology, Program Director, Dr. Erica Green. Graduates, Dr. Shruti Agashi, Dr. Ilya Dubavoy, Dr. Destiny Hooper, Dr. Vindhya Konaru, Dr. Harsh Patel. Neuro-ophthalmology, Program Director, Dr. Andrew Lee. Graduates, Dr. Peter Mortensen, Dr. Subhari Ravishkanthan. Neuropathology, Program Director, Dr. Suzanne Powell. Graduate, Dr. Alejandro Perez. Obstetrics and Gynecology, Program Director, Dr. Conrad Harms. Graduates, Dr. Danielle Bahari, Dr. Kara Hankins, Dr. Sarah Hoops, Dr. Amir Hossein Nakad, Dr. Jennifer Rumpf. Orthopedic Sports Medicine, Dr. David Lintner, Program Director. Graduates, Dr. Matthew Comley, Dr. James Jackson, Dr. Matthew Reed. Orthopedic Surgery, Program Director, Dr. Brad Weiner. Graduates, Dr. Derek Clavos, Dr. Hannah Morehouse, Dr. Hudson Seidel. Plastic Surgery, Program Director, Dr. Pierre Chevray. Graduates, Dr. Andrew Gratson, Dr. David Hill. Pulmonary Disease and Critical Care Medicine, Dr. Mukhtar Al-Sadi. Graduates, Dr. Shara Bachet, Dr. Sai Kata. Radiology, Program Director, Dr. Mark Sultanfus. This program is celebrating its first graduate, Dr. Niraj Patel. Robotic Oncology, Program Director, Dr. Brian Miles. This program is celebrating its first graduate, Dr. Evan Wenker. Surgical Pathology, Program Director, Dr. Mary Schwartz. Graduates, Dr. Ziad El Zatari, Dr. Ashley Garcia, Dr. Do Hwan Kim, Dr. Don Lee, Dr. Paloma Monroy Bosque. Spine Surgery, Program Director, Dr. Christopher Meyer. Graduates, Dr. John Eager, Dr. Alexander Molinari. Surgical Critical Care, Dr. Constance Mobley, Program Director. Graduates, Dr. Lisette Gomez, Dr. Samantha Thomas. Transplant Nephrology, Program Director, Dr. Hassan Ibrahim. Graduates, Dr. Andrew Evans. Urology, Program Director, Dr. Rose Kavari. This program is celebrating its first graduate, Dr. Natalia Hernandez Bustos, Dr. Christopher Tallman. Vascular Neurology, Program Director, Dr. Rajan Gadia. Dr. Nureldin Abdulhamid. Vascular Surgery Integrated, Program Director, Dr. Eric Peden. Graduates, Dr. Philip Oyang, Dr. Manuel Rojo, Dr. Muhammad Zubair. Congratulations to the 2021 graduates of the Houston Methodist Residency and Fellowship programs. We wish you all success, both personally and professionally. Know that you will always be a cherished part of the Houston Methodist family. As we end this ceremony, I'd like to take a moment to thank all those who helped to make this graduation possible, and those who supported our graduates along their journey. Our dedicated faculty, our supportive program directors and coordinators, the ancillary and support staff throughout the hospital leadership, and also would like to take an opportunity to thank Dr. Ryan Logue for serving as House Staff Council President during the past academic year. And last but not least, the staff of the GME office, who listen attentively to residents and fellows and tend to the needs of the programs. Finally, we wish you and your loved ones a safe and happy summer. Thank you and good night.